basically, what we should have in mind is that antibiotics are really a miracle in terms of therapeutics. Those antibiotics were starting on the market and to solve lives at the end of the Second World War. Yes, it was really a miracle, because at that time, when we were infected by, for instance, Staphylococci, you had 80% of chance for dying for Staphylococci infections, and just after antibiotics have become available for human health, this percentage has decreased to 20%. So it is really a miracle. Those antibiotics are really important for human health, but those antibiotics are also used in veterinary medicine. And the problem is that when you use antibiotics systematically, you select antimicrobial resistance. This is true in human medicine. This is true in veterinary medicine. So it is really a One Health problem. And those multi-drug resistant bacteria can transmit from one sector to another. They can spread. And the problem is that the more you use antibiotics, the most important is the spread of multi-drug resistant bacteria, and those multi-drug resistant bacteria can induce therapeutic failures. If you are infected by bacteria resistant to antibiotics, then you can be in real trouble if no or a limited number of antibiotics can help you. So the problem is, and why we are celebrating this, is because we are fighting against AMR. And each year, it's important to recall to everyone that antibiotics are really important in health in general. I mean, human health and animal health. What we can do everywhere is to have a better control of the use of antibiotics. This is probably not so easy in different parts of the world. It's differently easy also in different subsectors in human medicine and veterinary medicine, but the main driver of AMR selection is the use of antibiotics, the overuse of antibiotics. So what we first should do is to use antibiotics just when it is necessary and not to use them when it is not. In particular in veterinary medicine or in the animal sector, antibiotics are also used as growth promoters over the world, but not in Europe. In Europe, it's forbidden for 15 years, more than 20 years now. But what you can do in the animal sector is to stop using antibiotics as preventive molecules, preventive treatments, where it's not treatment, preventive administration, or growth promoter. And in human medicine, we must also control the use of antibiotics and not use antibiotics when it's not necessary. For instance, we can see in human medicine that you use more antibiotics during the winter, but during winter, the cause is because you have viral infections. And antibiotics are not inefficient against viruses. So there is a lot of progress to make, both in human and veterinary medicine. But the main driver is to use antibiotics as less as possible, just to spare them, because we don't have new antibiotics at the moment. So we should do with the existing antibiotics. So the best thing to do is to use antibiotics just as necessary. Another point that we have seen during the COVID crisis is the preventive measures. So we also need to prevent infections, and preventing infections is also the best way not to use antibiotics, of course. I think it's a commodity to a certain extent. It's also a kind of anxiety. If you have a young child suffering viral infection, you can also think that they can get also bacterial infections, infection. But it's also a lack of communication at a European level. For instance, when you looked at questionnaires on how the population, the global population, is aware of whether an antibiotic is efficient against viruses, you can be very, very surprised to see that a limited number, a limited percentage of the population only knows that antibiotics are not efficient against antibiotics. So a message is also to improve the knowledge of the global population on against what and against what is not efficient an antibiotic.